Will seeking treatment for my mental health condition affect my VA disability claim for mental health? Many veterans have asked me this. Well, I'm not going to go to the VA for treatment because that's going to hurt my claim, or I'm not going to, be treated outside the VA system, and I'm not going to provide those records because that could hurt my claim. And first of all, I want to say, if you are suffering a chronic mental health condition, as a medical provider, I always recommend getting treated for that mental health condition. Mental health treatment can improve coping mechanisms. It can support you and help you get better from your mental health condition. That treatment plan can help you improve outcomes, help you be more successful at work and with your relationships despite your chronic mental health condition. It's so important to get treated for mental health. All of the medical evidence supports that people that suffer a chronic mental health condition that receive treatment do better than people who do not seek treatment. Secondly, being treated for a mental health condition will support a claim. In the vast majority of instances, if you're being treated, it shows that you have a chronic problem. I mean, if you suffer a chronic problem and you go out and get treated for it and you're being seen regularly, counseling, whatever it is, that shows that you're suffering a chronic condition, because one of the requirements for receiving disability benefits is that you suffer a chronic condition. VA disability benefits are for chronic medical conditions that affect you and cause a loss of function in some way, affect your life. If you're seeking treatment for a mental health condition, you clearly understand that your mental health condition is severely affecting your life, and you're doing what you can to get better from that. So that's very important, in my opinion, to be treated for mental health and not hole yourself up and not seek treatment, especially not seeking treatment because you're afraid of it affecting a VA claim. Secondly, I want everybody out there to know, all the veterans listening, you're not required to be treated for mental health to receive VA disability benefits, because the VA is going to rate you based on your level of occupational and social impairment, not whether or not you're in treatment. The VA is not going to say, well, you're not in treatment, so we're not going to pay you. If you suffer a chronic mental health condition and that is shown, and it's shown that your chronic mental health condition is linked to your active duty service, you certainly can be service connected and paid regardless of whether or not you receive any treatment. In fact, many veterans that I've talked to that suffer severe PTSD, they don't want to have anything to do with treatment because it brings up all of these negative feelings and it can actually exacerbate their PTSD symptoms. Now, studies show that going through it, even though it's hard, improves long-term, functioning. But many veterans that suffer PTSD are absolutely, they don't want to seek treatment. And I want veterans to understand that if you suffer severe PTSD, you're not required to go to treatment. I certainly recommend it. Any professional mental health provider would recommend getting treated for your mental health because, as I said, it can improve outcomes. But you're not required to receive treatment in order to be eligible for a VA disability rating for mental health and to be paid for mental health. So again, don't be afraid to seek treatment. I do want to say, however, that if your VA medical records for your mental health treatment, or if they get records from your private provider who's treating you for mental health, if those records are inconsistent with your VA claim, of course it's going to affect your claim, because remember, the rater is going to evaluate all of the evidence in front of them, and if there's inconsistencies, that's going to flag the rater that perhaps you're being dishonest about your symptoms or you're exaggerating your symptoms. So all of that evidence is going to be evaluated when there's a decision on your claim. So you should always be completely honest with your claim, with your provider who's treating you for mental health. Don't diminish your symptoms when you go to counseling, because if you do and you're really suffering those symptoms, of course it can affect your rating or your mental health disability claim. So always be completely honest. You're not going to get anything out of treatment anyway if you're not completely honest. I mean, that's one of the tenets of mental health treatment, is being completely open and honest with your mental health provider. I know that can be hard, but that's absolutely necessary to get better. And of course, that's important too, so that you're rated appropriately. If you're filing a VA disability claim, you want all of your symptoms documented so you have the appropriate rating for your mental health condition. So don't shy away from treatment because you're afraid it's going to affect your claim. I mean, that's just not good for you, for your health, certainly not good for your claim, because so showing that you're seeking treatment and you're in regular treatment shows that you have a chronic disability that's affecting your life. So generally, the vast majority of cases that I have seen show that getting treated, those records being reviewed for your claim, support a VA disability claim for mental health and don't hurt a VA disability claim as many veterans believe that it will. So that's what I got on getting treated for mental health and whether or not it will affect your VA disability claim. Thanks for watching.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances